And for more on coronavirus concerns and information, we are now joined by CBS News medical contributor Dr. David Agus. Thank you for joining us.
That's right. Dr. Agus, first of all, we want to talk about...
Oh, it's my pleasure.
Thank you. We want to talk about what's fear versus fact. What should we really be doing right now with the number of cases that are happening in our area? You know, a lot of people are scared to go out, going to the grocery store, looking at each other, concerned about who might have something.
So there's no question there's a lot of fear going on right now. The purpose of many of the restrictions that are in place are basically to limit or to slow the spread of the virus. If we slow the spread of the virus, we're going to be able to have a medical infrastructure that can handle it. So they're not meant to be draconian by any means. And so we're not saying there's going to be large-scale death in the city at all. We're just saying let's slow the virus so that the medical infrastructure can handle it and we have time to develop the drugs that look very encouraging and are going to work. The key premise now is social distancing. As much as possible, limit the contact you have with other individuals. If you have to commute on mass transit or a bus, go at a time when it's not crowded. If you're going to the grocery store, again, go when most people aren't there, and then you're going to be able to have the limited risk. That's critical.
So again, Dr. Agus, fear versus fact. What's worse, the flu or the coronavirus? A lot of people are thinking, oh, once you get the coronavirus or if you're ever infected by it or get the virus, you're going to die at some point. But the flu apparently is worse, according to the statistics and the numbers, right? Or is it?
Not necessarily. I mean, they're both bad. So with the flu, we have a vaccine and we have drugs that work very effectively for it. And we also know it's going to peter out kind of end of April, beginning of May. The problem with this virus is we don't know what's going to happen. And in the 2 weeks kind of leading up to symptoms, people can be contagious without symptoms, which means that the spread of the virus can be much more aggressive than we see with the flu. So the flu we're prepared for with the medical infrastructure. Right now, there are very few empty hospital beds in the city because the flu is the dominant thing in the season. If we add on top of that we don't have beds for most of the patients. There's a multiple-hour wait in the emergency rooms now. That's going to go to double digits if we add on coronavirus. So we have to slow the coronavirus spread.
Well, lots of people, Dr. Agus, are stockpiling things like toilet paper, going to our local Costco and it's cleared out. Is this smart that people are doing this, or should they really take a step back and plan other things?
Well, I'm not sure toilet paper is going to protect you from this virus. That being said, there are going to be certain neighborhoods, and there certainly have been across the United States, where we've said, hey, why don't you stay in your home and limit going out? And so having 2 weeks of food in the house, and remember, it's not an earthquake or a storm. You're going to have water, you're going to have electricity, so frozen food or dry food, as well as 2 to 3 weeks of medication is critical for everyone in this country.
I'm so glad you said that, Dr. Agus, because last night one of the grocery stores was out of toilet paper as well. I guess the final question for you, tell us again, how are people coming into contact with the virus? Is it as easy as a cough? Because I know we're telling everybody to wash their hands, use hand sanitizer, limit, your access to events, large events or whatever. How are people getting the virus?
So in general, it's spread to the lungs. And so when somebody coughs, there's small droplets in the air, and you could breathe those droplets in, and it goes through a portal called a receptor in the lung and can cause significant symptoms in the lung. If it gets really serious, limit oxygen delivery to the lung. It can be on fixed surfaces. So somebody can cough, it could be on a surface, and it lasts there for a period of time. In general, that period of time depends on what is the surface, what is the conditions of the room, what is the temperature, anywhere from hours to many hours. And so that's why we're saying wash your hands so you don't then touch your face and get into your mouth and you can breathe it in. That's why we're saying wash all surfaces. If you're in an office, take everything off your desk so it can be cleaned at night. And we all have to use precautions that can limit the spread of the virus. This virus is going to spread over the next year to most of the country. If we can slow the spread of the virus, we're all going to do better, and we as a country are going to be able to limit the deaths from this virus.